general information. And so without further ado, I'm happy to introduce our Dr. Nehama Lewis. Nehama is a senior lecturer in the Department of Communication at the University of Haifa and our Chief Behavioral Officer. She was the head of the department's MA program in Strategic Communication and Public Relations, and she is a visiting scholar at the University of Amsterdam's School of Communication Research. Her research focuses on health communication, behavior change, and the design and evaluation of strategic communications campaign. Go ahead, Nehama.
Hi, thanks, Asaf. And thank you to everybody who's taken the time to register and listen today. I hope that I can give you useful information and timely information, especially for people who are wanting to understand a little more about how behavioral science can help you communicate more effectively with people, specifically with regard to enhancing the health of individuals and the public. So as Asaf introduced, I'm an academic, but I've been working with MedOrion for several years as their Chief Behavioral Officer. So I bring an expertise in behavioral science to the company, and I'm going to focus this webinar specifically not on MedOrion, but on behavioral science and explaining a little bit more about how it can work very well with technology and segmentation and what it can do as far as behavior change. So I've structured the webinar, first of all, to talk a little bit more about behavioral science. Many of you come from areas that you're likely very familiar with the theories of behavioral science. Some of you may not know as much. I'm going to talk specifically about behavioral science in the context of health. I'm then going to talk about source credibility, and you'll see what I mean by that. I will refer very briefly to some case studies to show you evidence that it works, that behavioral science has a real behavioral impact on health from campaigns that I've been involved in the past. And then I'm going to do a pivot to what is on everybody's mind today, which is COVID. And what do we do? How do we navigate a pandemic? How do we communicate effectively and strategically to people when there's so much at stake? And how does behavioral science help us minimize risks as far as talking to people in a way that will help them and not increase anxiety or misinformation? And finally, I'm just going to sum up with what I think are some really important benefits of using behavioral science. So behavioral science is psychology, but it's psychology that's focused on understanding motivations for human behavior. Why do people do things or not do things? And my focus has always been, why do people do health behaviors or not do them? And while many people in psychology have been looking at this since the 60s and 70s, it's only in the last couple of decades that governments and organizations and big healthcare organizations in particular have realized that behavioral science has a lot to offer as far as strategy and communication with the public. And you see this now with the COVID response. You see the WHO applying principles of behavioral science. You see it in OECD. You see it in the UK's response, which applies nudge theory, for example. But behavioral science has been used to change behaviors for decades. One of the earliest good examples that I like is from Robert Cialdini, who is a bit of a guru and a very smart scholar in the field of influence and persuasion. And he showed very nicely that using social norms can have a major impact on behavior in the context of recycling. So there's a lot of evidence, a ton of evidence out there of the utility of understanding the science of behavior as far as being able to change behavior and predict behavior. Now, why is this relevant today and why are we doing a webinar? Because we have a black swan as far as health. We have a pandemic that almost nobody besides Bill Gates could have predicted. And what we need is massive and very quick behavior change across the world, across different cultures. People are at different stages in different environments. How do we communicate very quickly and very well? So the answer is that there is actually a science behind communicating well in the context of behavior change. And first of all, we need to systematically understand how people think of risk and how people think of behavior and what is their trigger to behavior change. The behavioral science is useful in two contexts. First of all, it's useful in a lab. So there's a lot of lab-based science work. However, today's crisis calls for something that's much bigger, calls for something that's scalable, something that we can use to reach many people, but also talk to people in a way that gets to their specific motivations. So that's the beauty in my mind of being able to combine everything in these books, which I teach academically, with technology, which allows you to bring another piece of the puzzle, which is, okay, I know what to say. Now I can actually find these people using data, and I can match a message and a journey to a particular population. So what you have is scalable behavioral science that takes advantage of academic knowledge, but it also takes advantage of technology. So in this slide, my goal is kind of micro and macro. So when I teach persuasion, one of the first things I explain to my students is that a person is only as persuasive in as far as the people they're talking to think they know what they're talking about. So it's something called establishing source credibility, which is related to expertise. So what I would like to do in this slide, and at the risk of self-promotion, which I'm not here to do, the goal is to give you information to the extent that for this specific topic, my expertise is relevant. So again, expertise is very topic dependent. So as far as behavioral science, this is the relevant expertise. I completed an MA and a PhD in health communication at the University of Pennsylvania. And then I worked in a health intervention research group in Miami, in Florida International University for 2 years. I was interested in health behavior change for years, and I study and teach persuasion and campaign design and evaluation. And I am an academic and a senior lecturer at the University of Haifa. And I've had the opportunity to work in practice in the design of these kinds of campaigns with Mediterranean since about 2017. So I'm going to go through very briefly some examples that I would introduce as evidence of impact, because what interests me as somebody who works in the field of campaigns is the question of does it work? And when I say does it work, I mean, does it work as far as behavior? Because a lot of campaigns talk about engagement and clicks and likes, and that's necessary, but it's not sufficient, particularly when it comes to health behavior. So what interests me and what I try to do is show evidence in the form of actual behavior change. So these slides also explain the extent to which behavioral science is adaptable. It is adaptable across populations and across behaviors, because the same models can work in Israel, in France, in the UK, in the US. So the first the first piece of evidence is a campaign that was run in Israel. The behavior that we're interested in is HPV vaccination. We were targeting parents of 12-year-olds to try to get them to agree to have their child vaccinated with the HPV vaccination. It was a social media campaign in which we reached about 50,000 people, and we showed an actual increase of 11% in specific segments. And we used a theory called inoculation theory, which is not a pun in this case. It's an actual theory from psychology. And the goal was to preempt misinformation about this vaccine, knowing that that's an issue among this population. The second piece of evidence for impact is a different behavior. We were interested in increasing rates of colorectal cancer screening. This campaign was done in France, in Paris, and it was a great success. The effect of the campaign was a 15% increase in test completion. In fact, the stocks ran out of this specific test. We had 200,000 people in the sample, and it used a different theory. I applied the theory of planned behavior to the design of the messages in this campaign. It's a theory that's been widely used in health communication, and it has several core components, and we use those to design the messages. The final piece of evidence is actually not a health behavior, which I bring also to show that the explaining human behavior is not necessarily dependent on what the behavior is. My focus is health, because I believe in promoting public health as something that I've always been interested in. But the actual process of using behavioral science is not specific to health. So this campaign is with Blue Cross, and we used clinical claims data and behavioral AI to personalize engagement and create specific journeys for members that increased enrollment in Medicare Advantage. This is a campaign that was run in the US. So again, this process is not dependent on country. And we used a model from psychology, from information processing, to create campaign messages that were more likely to be seen as relevant, personally relevant for the members based on data that we have about those members. So we did this using social media, and we saw a 15% increase in enrollment, which is great. And the final slide before I pivot to COVID. We're in the field right now trying to reach members regarding this specific crisis that everybody's living through. We're reaching people in the US again with Blue Cross, and I'm using, the team are using a range of approaches and theories from behavioral science, information processing theories. And we're also dealing with emotional responses to the crisis. We're using emotion in a way that will motivate people to do behaviors that will enhance their own health. So this is in progress. We don't yet know what the outcomes are. Okay, so we're getting to the major question of the webinar, which is, how do we navigate a pandemic? Nobody has lived through anything like this, I think, since the previous template was 1918. So how do we influence people's behaviors in a time of crisis? What we know is that everybody, including most likely everybody on this webinar too, is in a state of crisis as far as information. We're bombarded with information. There's a lot of information specifically about health out there, some of which is not true. It's confusing. There's a lot of anxiety around the issue of COVID, and it's impossible to escape information as well. So given that we know that people that we're trying to reach are in this environment, what do we do? Because it's increasingly clear that the best way to get through this is by flattening the curve, obviously. But flattening the curve requires everybody to change their behavior. So how do you suddenly get everybody to change their behavior in a short amount of time? Especially when there's a lot of missing information, there's a lot of unknown variables that are, you know, just now we're trying to work out how is it transmitted, what is the transmission rate, etc. So my argument in this webinar, and something that I believe is becoming increasingly clear, is that you need behavioral science in order to understand why people are responding as they are, and how do we channel behavior in a way that's effective for people and for those around them. So the way I look at behavioral science and how it interplays with segmentation and big data is that the two are inextricable. You need behavioral science in order to guide you into knowing what to say. How do you say it? Do I use a picture? Do I try to make people scared? Do I try to make people, do I reach out with empathy? Do I want an appeal to logic or to emotion? Do I want a testimonial? Who should be my source? These are all questions that behavioral science can help with. However, behavioral science only takes you so far. The other side of the puzzle is the segmentation, which is when, knowing what you know from behavioral science, you look at the data and you say, who is my relevant segment? How can I reach them? So it's an iterative process as well, because sometimes you want pieces of the data that you may not have, so then you go back and you look and you see what you can do with it as far as your insights. I found, preparing for this webinar, a really excellent review, which I'm going to sum up for you quickly, by a group led by Peter Lunn, and the link for it is there. Peter Lunn and this group did a quick review of COVID as far as what do we know, what are best practices, and how should we communicate. And all of these, I think, are very relevant to organizational communication with members as well. So first of all, which behaviors do we want people to do? Obviously, we'd like people not to get sick, but that's not something we can control. We can only control behaviors that are related to risk. So the first of these is hand washing. Now, with hand washing, the issue is that it's not that people don't know they have to wash their hands. Education is not the key to behavior change in this respect. What you need reminders, and you need people to act on their intention. So what I have here in this slide is a picture from my stairwell in my house, because as you go out the house, you have all the supplies there to remind you, put your mask on, clean your hands, etc. And what we want to do when we communicate to people is help them remind themselves to make their physical environment such that the behavior becomes easier to do, which is closer to nudge theory, actually. So you don't tell them why hand washing is important, because people know that. You tell them to put a Post-it by the door saying, did you wash your hands? And that's more likely to change their behavior. Another thing that the authors mention is that evoking disgust is a universal emotion. It's a very powerful emotion. And they say that invoking disgust is a great way to motivate people to actually use hand sanitizer. And you can think of that as far as creative messaging. And there's strong evidence for being able to change this specific behavior. With a second behavior, self-isolation. So besides the law enforcement component that people are scared to get fines, etc., the issue is social isolation. Again, we find ourselves in uncharted territories, because what we do know from psychology is that there are pretty serious long-term adverse effects of social isolation on many individuals. And we will only know some of these effects down the road in a year or more from now. What we can do now, and what's important to do now, is preempt these negative effects by offering people support and advice. There's a lot of advice out there. Anyone on Twitter, you can come across 10 things to help you with social isolation. But scientifically, what we know helps is to tell people to create a routine. Human beings do better when there's a routine. They create a new structure to their day, and that can be mentally helpful as well. You encourage them to reach out to other people. With the third behavior, face touching, what's very interesting is that it's actually very difficult to get people to stop touching their face. And what they found is if you tell people to stop touching their face and then you put a hidden camera in the room, people will actually touch their face more. So it's not smart from a scientific point of view to try and shape that behavior. And the reason is because it's not under our conscious control. We don't rationally think about it. So any behavior that's not a rational behavior is very difficult to change. The authors also suggested two suggestions to motivate people. One of them is use a public spirit, use a this is best for all strategy, what they call desired collective behavior. What they say is that works best when there's a group identity. So you say, all of us are in it together, we're here together, your family are there for you, that kind of thing. You make group identity salient and you make it a very clear case of you're not alone. Another way to do it is through punishment, not punishment as far as fines or police punishment, but social disapproval. This can also backfire. I don't know if any of you are on WhatsApp groups where people tell on each other as far as who wasn't complying to the rules about where you can be. This is a risky strategy, but it's better to go on the more positive strategy of, we're all doing this together. Regarding crisis communication, what's really important anytime you communicate is to show empathy and understanding. Some people are coping better than others, but it's important to understand that not everybody has high efficacy when it comes to the situation, both on an emotional level, but also in terms of understanding risk. It's important to be honest and speak to people in a way that shows that you understand that this is not an easy situation. What you should also do, and we're going to get into more detail as far as numbers. When you talk about risk, there's a lot of ways you can do it badly. and it's important to understand the science of talking about risk before you do that. So one way is to discuss a range. Like, we could come out of lockdown anytime between, say, May and September. At the moment, we don't know. It's a mistake to talk about certainties when there are not certainties. People are okay with uncertainty as long as you acknowledge it. And with fear, fear is a great motivator, and you can get people to do a lot of things by increasing their sense of fear. However, it's risky if you don't tell them that there are ways in which they can reduce that fear. That creates unnecessary panic. And I'll go into a bit more discussion about that soon. So what I have here for people familiar with these, and many of you might be, are the CDC guiding principles of crisis communication. And these are very relevant also for communicating about COVID, some more than others. So if you're working in an organization, the first one is more complex than it seems. The CDC says it's important to be first, provide information first, but it's more important in my mind that it be accurate. So sometimes speed versus accuracy, it's better to be accurate even if your competitors may reach out before you to speak with their members. What's important with accuracy is to acknowledge what you know at the moment and what you don't know. People will feel that you're a more credible and trustworthy source if you acknowledge exactly the limits of what you know at this point. Another thing is to be honest. There's something called hindsight bias. So there's a lot of biases in the way people process information. And one of them, hindsight bias, is when people constantly reevaluate their assessment of risk. And so at X point in time, they'll think that, something was unlikely, but later when that thing happens, they'll reassess and they'll say, oh, well, of course that happened. That was likely. That's called hindsight bias. And then they'll judge backward and say, you should have known. So how you avoid being a victim of hindsight bias is at every point in time, you say, based on what we know now, these are the facts, or this is what people think. And that way it's more difficult for people to go back and say, well, you should have known. If you make it clear that knowledge is a fluctuating thing. But on the other hand, you don't want to say that you don't know everything, because then you shouldn't be communicating if everything is unknown. That will reflect badly on your perceived expertise. Again, the CDC emphasized the importance of empathy. You need to be empathetic to the public, and sometimes that's a question of who is talking. Some people can relay empathy better than others, and it's a question of who in your organization, if you're on camera, for example, is somebody who comes across as more empathetic. Promoting action, it's important to tell people things that they can do. Telling people don't get sick and don't get other people sick, that's not a useful suggestion. You need to tell them things that they can actually do, that they're capable of doing. One example from Israel that I can talk about as an example that's a confusing action for the public is that we currently have a 100-meter limit to walking outside. So that, on the one hand, 100 meters is clear, but many of people in the public are confused about the arbitrary why 100-meter distance. They don't understand how that's helpful as far as reducing risk. So promoting action has to be actions that people can understand the logic behind them and that they can do. And finally, show respect. So what we're seeing now in many countries is that the COVID is affecting different groups differently. Again, a local example in Israel, we have the Orthodox community who are more severely affected by the pandemic. And it would be helpful in circumstances like that to bring in people from those groups to get them involved in the strategy and in the messaging. That way you also get the endorsement from inside the group and you involve them in decision making. And it doesn't seem that that's being done today, at least in Israel. I'm going to briefly talk about a few models from behavioral science before we get to the Q&A. One of them is the behavior change wheel. So the behavior change wheel, and the source word is here, talks about 3 elements that have to happen in order for behavior to change. The first one is capability, which is psychological and physical capability. The second is opportunity, which is, can you do it in your environment? And the third is motivation. Do you want to do it? So if you look at the first picture I have here, Gordon Ramsay, he was recruited to show people how to wash their hands. So washing hands, again, not very difficult. But we have a good use of a celebrity endorsement for something that people can do. Presumably, most people have access to running water, I would hope. And it's helpful in increasing motivation to remember to do that. Now, the middle picture is a bit more tricky. It's testing. And testing is a sensitive topic because, unfortunately, a lot of people are in a position where they may be motivated to get tested, but they're not capable or don't have an opportunity to get tested. So this is a behavior that we can't necessarily recommend that people do until the environment matches that. And the third one is exercise. So we know that exercise is really important. And speaking as somebody who's spent more than a month and a half with 3 children, I can tell you that it's very important to keep them active. But how can you do that if you're limited to your immediate environment? So one good thing is to think about ways in which people can perform health behaviors despite the fact that the environment has changed. So here you can have YouTube videos for exercising or dancing or things like that to make it more likely that people will change their behavior. Again, the easier you make something, the more attractive, the more social, and the more timely, the more likely people are to do it. Sometimes that can be by getting, as we have here, a celebrity. Sometimes it's just explaining how to do things. These are all helpful based on scientific research. Another model that was developed in the field of health, specifically for health behavior, is a model that's also very amenable to using with technology. The health belief model has 4 basic components, and all of these components are useful. The relative emphasis on different components should be varied by the group you're talking to. So I'm going to break this down very quickly. Keep in mind that this is a topic that could take a lot longer. So the first component is perceived susceptibility. In order to get people to change their behavior, they need to think that they're at risk. So that's one component. People will not do anything unless they feel personally at risk. The second is severity. They have to think that the risk is severe. I think with COVID, that's fairly true, except for some groups, for example, younger people, for whom this may be an issue. Response efficacy are behaviors that are proven to be effective in reducing risk, for example, social distancing. And self-efficacy, the fourth element, is telling people that they can do it, affirming their abilities to do it. So what we have here on the slide, we have 4 different messages, each of which represents one of these components or emphasizes one component. The bottom left is a message to smokers. Now, smokers are a higher risk population, specifically for outcomes of COVID. So what we need to do if we're reaching out to smokers, if we have data that identifies that group for us, then what we need to express to them is that they are specifically susceptible and that the risk for them is severe. So the emphasis for that group would be on elements 1 and 2. And then you would tell them, once you've established that they're at higher risk, what they can do about it. But the data helps you specifically reach them based on what you know about their current behavior. The second image is a graph that's an example of how you would portray severity. Linear graphs and exponential graphs are everywhere, and the message is clear even for people who don't understand graphs, that it's severe and the threat is increasing. Response efficacy, that's the orange and blue graph and poster. What can you do? So response efficacy is a list of things, very specific guidelines, what can you do? And the last one is more tips, and here you can call us, here's more information. And again, why is this useful? So you can teach this model academically, and that's interesting, but the actual use when it comes to technology is when you combine these insights with data. So you can segment your population, and just like you turn a volume knob, so you can turn the knob differently between these elements within messages depending on who you're trying to reach. Healthy people, people at risk, infected people, recovering. Different groups would require different elements within this model. And finally, some specific recommendations when it comes to communicating about COVID. First of all, communication is kind of, in a way, a bit like the Hippocratic Oath in the sense that you want to do no harm, first of all. However, communication can have unintended negative effects. One of the effects that we try to avoid in campaigns, in my experience, is increasing stigma. Stigma is something that you can unintentionally make salient when you create messages that talk about specific groups that are at higher risk. For example, people who are severely overweight are at higher risk of poor outcomes in the ICU. However, you have to be very careful if you're creating messages not to further stigmatize a group that's already stigmatized. And again, also with smokers, that's something that you need to keep in mind when you talk to people. Another unintended effect is anxiety. People are anxious enough. Everyone's stressed. So you don't want to just send more information that isn't going to have any kind of utility. And the third is to be very careful not to make requests of people that they're not capable of doing. So telling people that are limited to 100 meters around their house to keep up with exercise, that's not a very feasible request. With social norms are a major area of research in psychology, but they're problematic. They're something that you have to be very careful about using. For example, every time the news highlights panic buying of toilet paper or, eggs or whatever, what they're doing unintentionally is making more people go out and panic buy. Because human beings, that's just how we are. We think that there's X amount of something and everyone's going to buy it, so then we all rush out to buy it. So you don't want to highlight that because then inadvertently you prime that norm. What you can do is you can highlight good norms, people who are helping other people, people who are going around and dropping off supplies for older people. That is helpful based on science. Optimistic bias. So with optimistic bias, the idea is that most people like to think of themselves as not at risk. Like, my neighbor is going to get sick, I'm going to be fine. That's a human way in which we navigate the world. We try and think more positively. So that's okay. However, when you're talking to people about COVID, you don't want them to be too optimistic. You want them to still have some basic level of motivation to avoid risk. So if you think about it again, like a spectrum between complete complacency and high anxiety, you don't want either. You want to find like a happy medium in between those two. And that's something to keep in mind when you're messaging. Another thing is framing. Framing is another topic of research within psychology, but it's very easy tweaks to a message that can make a big difference as far as people's understanding. So instead of talking about the number of people who have passed away from COVID or in the ICU, the messaging can talking about the percentage who are recovering or experiencing mild symptoms. You're not telling information that isn't true, you're just looking at it from a different perspective and reducing the anxiety levels at the recipient level. And finally, and everybody can think of their own national responses to COVID as I described this, source credibility is important. Just like I began the webinar by trying to establish my own credibility, we believe people when we think that they know what they're talking about. And credibility is a function of, do you think the person's being honest? Do you think they know what they're talking about? Are they objective and are they consistent? And unfortunately, we see that a lot of governments and officials and spokespeople aren't meeting all of these standards, but that's something that, you would want to aspire to. Before I end, and this is the second last slide, I'm going to give you a very specific example of how we would apply some of these ideas to the COVID case. So something that I've been working on recently is a behavioral objective that's not obvious, but it's very important. If you think about public health, a lot of the long-term effects of COVID are going to be seen in 1 year, 2 years, 5 years from now, because a lot of the long-term effects are from people with ongoing health issues that are not treating those health issues during this pandemic, either because they're not able to, or because they're not motivated, or they just can't manage to do that given everything else that's going on. So one thing we can and should do now is preemptively help people understand that they need to take care of their ongoing health needs besides everything that's going on with COVID. This is good for them, and this is good for the health system in general, and this is a public health desired outcome. So if you were to try and achieve this outcome, you would want to specifically reach people who had chronic disease. If you could reach a specific segment, for example, older people with 2 or more chronic diseases, then you would apply behavioral science to try and get them to change their behavior and to manage their health conditions. One theory that can be useful is social cognitive theory, which is a great theory that's being used very widely in psychology. And the theory suggests that there's several basic components that motivate people to change their behavior. So applied to this situation, the first would be knowledge. A lot of people with chronic conditions may not know what to do in this circumstance. No one's ever told them how to manage their health when hospitals are full of people with COVID. So what you need is to provide them relevant and accurate information that is specific to their condition. So for example, if they're dealing with diabetes, they need to know how do they track their glucose? How can they get information about managing diabetes at home? What symptoms should they keep an eye on? And you want to give them accurate information before it becomes a problem. Secondly, empathy. These are people who are in unusual stress as far as this situation. Managing their health is something that they may be concerned about, but they're also concerned about COVID like the rest of us. Self-efficacy, you break down what seems to be a difficult challenge, which is managing their health by themselves when they feel that they don't have the typical support in the health environment that they have. And you give them very clear steps. What can they do today? What can they do next week? You break it down to them to increase their confidence. And finally, it's important to provide support. You give them links to resources that they can use, to web pages, to phone lines that they can call. These are all proven ways in which you can help them achieve the behavioral objective. So to sum up, why do I think that using behavioral insights and behavioral science has value for changing health behavior? First of all, I think part of besides the impact that I've seen in my own work, the combination of technology allows us to get campaigns out and test them very quickly. What would take me a year to design in a lab can be done much more quickly using equally strong experimental methods online. You can create and design messaging, and then you can see what's happening in the field with your messages. The second is that you can tailor the content and the format in a way that is theoretically and empirically designed to be more engaging for that person. You can make sure the relevant information gets to the right people so that you're not just mass messaging everybody. And that will increase the likelihood of behavior change, which is the main goal. Third is that it's scalable. Again, what the beauty of using technology is that the same insights can be used on massive scales. You can reach many people. They can be used across different behaviors, across different populations. You can have an impact that's really, really large as far as changing people's lives and improving their health, which is something that I personally find very satisfying. Again, what I like about the aspects of combining behavioral insights with technology is that it's dynamic. What happens a lot of the time is that circumstances change. If you think about COVID, in a month, we might need another behavioral objective. So then you would go back and you would do the research and find out what are the factors that drive that specific behavior, and you can adapt accordingly. And finally, one thing that's important is that none of this is based on intuition. This is not one person's idea. This is not invent the wheel for each campaign. These are empirically tested theories that have been tried in laboratory conditions, but also in wide-scale interventions around the world. So the empirical scientific base is strong. Okay, so I'm gonna stop sharing the screen for now, and we can open the Q&A, and I'll give this back to Asaf.
Thanks, Nehama. Well, I already heard most of it. I'm still excited to hear it again. I think maybe you can leave the screen on, so if anyone wants to see the emails and how to contact us, they can do it while I'm asking you a few questions that we got from the audience.
Sure.
So we got actually from two different people. We got two very similar questions, which I'm also curious to hear what you think about it. So I will read both of them, and then you can answer. So what is your suggestion in case where the politician leaders contradict and criticize the medical professionals, and and in this way they undermine the credibility? And we can all think of the same example: President Trump versus the CDC expert. And another participant asked a very similar question, that the problem in the US is that politically motivated misinformation. What do you suggest, in this case, specific health insurance company that needs to counter misinformation to get the member to do the right thing, in the COVID-19 situation? So what do you think, Nehama?
So countering misinformation, that's a whole another field, in the sense that comes down to who do people think is more believable. And unfortunately, in some cases, people's perceptions of what's believable don't match what we would like to think is believable as far as, relevant expertise. And what we have sometimes is a case in which, for example, you have somebody with medical expertise who's saying things and is contradicted by somebody without medical expertise. The public will typically be able to discriminate between different types of expertise, but in persuasion, we think of changing people's minds as along a spectrum of how much are they motivated to listen to and how biased they are. So we know that some people are fixed in a specific place on the ideological spectrum for any topic, and that it's virtually impossible sometimes to change their mind. There are ways in which you can appeal to people. You can use a testimonial by somebody like them. It's typically a mistake to go head-to-head in a credibility fight, because that can make the person you're attacking seem like a victim, which is, it takes the battle away from the information you want people to get, and it takes it to a form of, who do you politically support, which is it's not good for public health. I don't know if that answers the question. And whoever asked the question, hold on, can respond. Okay. Asaf? So I have a question here from Rafael about the discussed approach. Positive reinforcement, yes. Asaf, if you don't mind, I'll take that one. So with regard to negative emotions, there's a lot of research in psychology on the role of emotion in changing behavior. And I think that when you talk about negative emotions versus positive emotions, it's great if we can motivate people using positive psychology, and there's a lot of good work on that. But sometimes it's actually more helpful to motivate people using what we would call, say, negative emotions. And there's a lot of research on fear appeals. and how to use fear in a way that's also ethical, in the sense that if you're telling people things that are true, then fear is a significant way in which you can make them rethink their behavioral choices. And if using disgust, for example, to get people to wash your hands, I agree that it's dangerous in the sense that you don't want to overdo it so that you're not going into territory where you make people like obsessive about germs, because that's not a good thing either. So emotional persuasion is an area in which you need to actually understand the psychology a little bit in order to find the exact balance between motivating people and then not going too far as well.
Yeah, that makes sense. That makes sense. Maybe a couple of more questions that we get. It seems that large segment of the population is motivated not to get COVID, and so they would early adhere to behavior change recommendation. But what do you think, Nehama, about the unmotivated people? Would you address them any differently?
Yeah, so I think that the responses to COVID are very much, they can be looked at both culturally as far as how different cultures maybe respond to a health threat, but also in as far as the immediate social response, and then what happens 2 months later. So if I'm asking somebody to socially isolate right now for 2 weeks, that's a big request. And the public will adhere to that request. But if I ask them to stay at home for 4 months, that's a completely different request. And at that point, the proportion of people who are willing to adhere to your request is going to decline. So there's the time aspect, and there's also the epidemiology of who's at higher risk. So we know in the UK, for example, there's been a lot of press about younger people going out and meeting up in parks and socially. And in Florida too, all the people on spring break. And what that is, it's a case in which younger people don't feel that they're at the same risk as older people. So they're less likely to adhere to guidelines. So what they need is a different messaging strategy, which is don't do this for yourself. Do it for your parents, or do it for your grandparents, or some kind of different appeal. So the susceptibility for them is not their own susceptibility, it's somebody else's susceptibility, which is a tricky message, but it's possible.
Yeah, I see it. Actually, we are getting some interesting questions live, and we don't have enough time to answer all of those. So I'll try one more, and let's see how much time we get, because I'm actually interested to hear what you think about this question. So Lou Berman here says, first of all, that it was a terrific presentation, and I agree with him. So you noted that the social support is known to positively impact health outcomes. In the US, the African-American community is being disproportionately affected by COVID-19. How do you approach messaging to this community, and what role does increased online social engagement and support have?
So yeah, that's a really important question. I think that what we have in the US at the moment is a really problematic situation, and I teach this in class, so I've been following the statistics on this, in which there's existing structural inequalities as far as healthcare for some groups, and African Americans are disproportionately negatively affected sometimes when it comes to health outcomes and health services and insurance and that kind of thing. And this is also being evidenced in their risk as far as COVID. What you need, I think, if you're trying to message people based on this risk group is, first of all, understand what the accurate risk information is with regard to the group. Is it a question of underlying health issues? If so, like, how would you address people with these health conditions? Can you specifically target people, for example, who have chronic diseases within the African American community, and explain to them about risk factors in a more targeted way? And if so, can you find somebody who would be a credible source for that community specifically? Can you get stakeholders from the community to help you spread the message, to be in the message, to endorse your message? I think that's really important. I think that it's organizations, when they bring in people from the communities that they're trying to reach, it's both ethically a better thing to do, but it's also strategically a better thing to do. That would be my advice. And it's the same here for the Orthodox community. I think that we have a kind of a parallel in the sense that the numbers of infections in the Haredi community is very, very high. But the messaging isn't reaching that community because they're not on internet channels typically. So there's a strategic mistake being made here in that we're not getting stakeholder buy-in from the community. And that's really critical because we're just not able to reach them and they are at higher risk. But I think it's true for any community. You need to involve people from the community.
Yeah, makes a lot of sense. So one last question to be cautious of our time, and I'm doing it in chronological order because unfortunately we won't be able to answer all the questions. So Rafael Shamir asked again, exposing people to negative effect, for example, disgust, will generally demotivate participants. No, and then shouldn't we use positive reinforcement?
Yeah, actually, I read that one earlier, so that's the one I addressed. It's an interesting question because it relates to negative and positive psychology.
Yeah, I'm sorry, I saw two questions here, and
no, it's okay.
Anyone, another question, maybe the last one. What are the minimum skills need to be taught a healthcare organization before it can confidentially begin apply behavioral science technique to managing its own patient population? I don't know if you can answer this in 1 minute.
No, I can say that the field of behavioral science it's its own field. There's an entire subfield called health communication, which I did my PhD in, but there are some great people working in that field in the US and other countries. And these are people who have that specific expertise. They have the grounding in psychology, grounding in methods, in understanding health behavior, that kind of thing. So if you're looking for people with this specific expertise, health communication would be the relevant subfield.
Perfect. So I think we'll stop here. Thank you very much, Nehama,
sure.
for doing
Thank you.
Yeah, and thank you all of you for participate in this webinar, and we look forward to seeing you in the next one. Have a safe stay home journey. Bye-bye.
Bye, thank you.